Hi.
Hi, I've got an appointment at 2:30. I think we're a bit early.
Okay, that's no problem. I just need to check some details with you first. Can you just confirm your name, your address and your date of birth, please?
Yeah, I'm Mrs. Anne Green and my address is 12 Clare Street, Cardiff, CF11 8TE. And my date of birth is the 7th of May, 1978.
Okay, that's brilliant. Since we last saw you, have any of your personal details changed at all? I've got a telephone number ending on 4225 on the system.
Yes, nothing's changed. No, I don't change my mobile phone. I never remember a new number.
I know how you feel. I can never remember my number either. Would you and your friend just like to take a seat and you'll be called in by one of the medical team shortly? Thank you.
Thanks.
Ignore it, it's fine.
No, I know. It's just a bit too much for me. I get the need to talk about death, but I really don't want to see that.
No, I don't want to be seeing two men kissing either.
Do these posters even need to be up? I mean, it's just too much.
I totally agree with you. It's disgusting.
Mrs. Anne Green, please.
Hi, that's me.
Hello, my name is Richard. I'll be working with Dr. Griffiths in today's clinic. Would you like to come this way, please?
Hi, sorry, is it OK if I come in as well?
Yes, of course, as long as it's okay with Mrs. Green.
Well, I don't really want to be on my own, so I would rather it if that's okay.
Oh, absolutely, yes, follow me. Have you seen Dr. Griffiths before?
No, I haven't.
Oh, you'll be fine. She's lovely.
Oh, good.
Come this way.
Hello, please can you take a seat?
Right, thanks.
Hello. My name's Dr. Griffiths. Which one of you is Mrs. Green?
Well, I'm Mrs. Green, the patient.
And this is?
Sorry, I'm Rachel, I'm the wife.
Well, it's really lovely to meet you both. And I think it's great to have a spouse come to an appointment with you because I think sometimes they can ask the questions that you forget.
You've no idea how often people think Rach is my friend, when in actual fact, she's my wife. So, yes, thanks for including us both in the appointment, and it's just made me really feel at ease. The attitude of the consultant just wasn't what I expected after we'd sat in that awful waiting room.
Oh, you mean the comments about the two men kissing?
Yes, exactly that. Oh, she just got it so right. Oh, I'm so glad she didn't have the same opinions as the rest of the staff.
No. Oh, come on.
You handled that situation so well. How did you know what to say?
I think that we're here for all of our patients, and I don't really think that I did anything special. I just wanted to make sure that they felt comfortable by asking who Rachel was and acknowledging that they were in a relationship helped me to build a good clinical rapport that was open and honest. And I think really they're just in a relationship like anybody's in a relationship, and I think we should respect that.
Do you know what? I feel really bad.
What's happened?
I overheard some staff members making inappropriate and unacceptable comments about a poster showing two men kissing in the waiting room. I did nothing, but I think I should have.
So what do you think you should do?
Well, I'm going to speak to them, just to make sure that they understand the impact they can have on the patients in the waiting room.
Yeah.
I think I'll then speak to their line manager, just to make sure that something can be done, so this sort of thing doesn't happen in work again. I'll speak to them once the clinic is finished.
I think that's a really good plan, and I think that's the best thing for you to do.
Great.
Yes, busy clinics doing.
Yeah.
Would you mind if I had a word, please? It won't take a second.
No, of course.
I just wanted to say, we had a same-sex couple at an appointment earlier who overheard you both mention that you were disgusted at the sight of seeing two men kissing on a poster in the waiting room. I just wondered if you realise the impact of your words and how you made those patients feel.
Oh, I'm sorry. This is just the way I feel. I didn't realise they complained.
They haven't, but I am. Don't you think that overhearing homophobic language from you as staff members adds anxiety to an already worrying situation?
I hadn't thought of that. I suppose we should keep our opinions to ourselves, particularly in patient areas.
We do have zero tolerance across the health board in both patients and staff areas. I will be taking this to your managers, as it does need to be addressed.
I hadn't thought of that.
Me neither. I think we messed up there.
Yeah.
Please speak up if you hear language which is unacceptable or actions which are unacceptable. It makes a real difference, and it'll make a real difference to you as well. You'll feel much better, and together we can change things.